You know that burning feeling of heartburn? That awful discomfort when your stomach is just producing way too much acid? It's a super common problem. But what if I told you there's a kind of covert agent, a highly specialized medication, whose only mission is to get inside your body and shut down those acid factories right at the source? Well, today we're declassifying the entire file on Lansoprazole.
So here's our game plan. We're going to start with a quick mission briefing on what exactly Lansoprazole is. Then we'll get into the tradecraft, how it shuts down the proton pump. We'll check out the official target list, who this is for, and the strict rules for taking it right. And of course, we have to cover the risks and side effects before we wrap up with a final debrief on why you have to use this powerful agent wisely.
All right, let's start with the mission briefing. Our target is an internal threat. We're talking about acid factories in the stomach that are just completely out of control. The objective, neutralize that threat.
So, Lansoprazole is the code name for a top-tier operative in a class of drugs you might have heard of, Proton Pump Inhibitors, or PPIs for short. And its function is simple and incredibly decisive, to dramatically, and I mean dramatically, slash the production of stomach acid. Honestly, it's one of the most effective tools we have for this job.
The specific problem it's built to solve is when your stomach's acid pumps are just stuck in overdrive. See, what makes Lansoprazole so incredibly good at its job is that it doesn't just try to clean up the acid that's already there. No, it goes straight to the source and cuts off the final step of acid production itself.
Okay, now for the really cool part, the tradecraft and tactics. How does this agent actually pull off its mission inside your body? This is where the brilliant design of this medication really starts to shine.
The main target is something called the proton pump. The best way to think of it is as the master switch in your stomach's acid factory. It sits in these special cells, and its one and only job is to actively push acid out into your stomach. Lansoprazole's mission is to find every one of these switches and just flip them to the off position.
And this brings us to a really fascinating idea. Lansoprazole is what's known as a prodrug, which basically means it's a sleeper agent. When you first take it, it's completely inactive, harmless. It has to travel all the way to its target zone before it gets armed and activated.
So here's the mission sequence, and it's just brilliant. First, it gets absorbed into your bloodstream. Then, it uses the bloodstream to travel directly to those acid-producing cells. Now here's the genius part. It only gets switched on by the super acidic environment it was sent to destroy. How cool is that? Once it's activated, it permanently latches on to those proton pumps and takes them out of commission for good. It's like a smart bomb that only arms itself right before it hits the target.
And the result of all this? A total shutdown of those specific pumps. And because that bond is permanent, your body can't start making acid again until it physically builds brand new pumps. That's a process that takes a full 24 to 48 hours. It's the reason a single dose can have such a powerful, long-lasting effect.
Okay, so with a mechanism that powerful, who's actually on the official target list for this medication? Let's take a look at the primary missions it's usually assigned to.
Its missions really run the gamut, from really common stuff like treating GERD and healing painful peptic ulcers, all the way to more specialized jobs. It's a key player when you're trying to eradicate H. pylori bacteria, it's used to protect the stomach from damage from drugs like ibuprofen, and it's a frontline treatment for some really serious conditions like Zollinger-Ellison syndrome.
Now, an agent this specialized and this powerful needs a very strict protocol. I mean, to make sure the mission is a success, you have to follow the rules of engagement. This is not a medication you can just be casual about.
And the single most important rule is this one right here. Timing is everything. Seriously, if you get this part wrong, the whole mission could fail.
So here's the deal, and it's absolutely crucial. You have to take it 30 to 60 minutes before your first meal of the day. So why is that? Well, it's because food is the signal that tells the proton pumps to wake up and get to work. By taking the medicine beforehand, you make sure that sleeper agent is already in position, waiting to strike the maximum number of pumps the second they become active. And whatever you do, do not crush or chew the little granules inside the capsule. They have a special coating to survive the stomach acid so they can get absorbed where they need to be.
Now, it does come in a few different forms to help people out. The delayed-release capsule is definitely the most common, but there are also tablets that dissolve right on your tongue, which is great for people who have a hard time swallowing pills. There's even a liquid suspension.
All right, no mission, no matter how precise it is, comes without some risk. So we have to be honest and assess the potential collateral damage, or, in medical terms, the risks and side effects.
So you can kind of split them into two groups.
On one hand, you have the more common side effects that are usually pretty mild and tend to go away. Things like a headache, maybe some nausea. But on the other hand, especially if you're using it for a long time, there are more serious risks to think about, and it's really important that you understand what they are.
See, when you suppress stomach acid for long periods, it can actually mess with your body's ability to absorb key nutrients from your food. This can lead to things like a vitamin B12 deficiency or low magnesium levels, which can affect your muscles and even your heart. It can also make it harder to absorb calcium, which over time could potentially increase the risk of bone fractures.
Your stomach acid also acts as a natural defense barrier against nasty bacteria. So when you lower that acid, it might slightly increase your risk for certain infections, like a gut infection called C. diff or even pneumonia. There are also some rare connections to kidney issues and really important interactions with other common medications that your doctor absolutely needs to know about.
And all of this brings us to our final debrief. Look, lansoprazole is without a doubt a powerful and incredibly effective agent against acid problems. But that kind of power demands respect. There's a quote from our source material that just says it all perfectly. Its power comes with the responsibility to use it judiciously. This is a highly targeted tool. It's not meant to be a casual, everyday fix for a little bit of indigestion.
And using it judiciously means following these key precautions. The goal should always be to use the lowest dose that gets the job done for the shortest amount of time possible. It is so important to not self-medicate with this for long periods and to always have this mission guided by your doctor.
So I want to leave you with this final, crucial question to think about and to discuss with your doctor. Is your use of this medication a short-term tactical solution to fix a specific problem, or is it slowly becoming a long-term strategy? Just understanding the answer to that question is the absolute key to using this powerful agent safely and effectively.